right, good morning, BNI. Well, I'm Dr. Ash Bhakta, and my wife's the other doctor, or the main doctor. And Willow Tree Dental, the boss, the main boss. So, my presentation is going to be pretty much the same as last year because there's a lot of you bases here. So, there's a few people that will get to the end that I'm not allowed to speak. John Soluto, not allowed to speak. So I was born and raised in Zimbabwe, which is in southern Africa, and then attended UTA, got my BS in microbiology. 19? Yeah, paying attention, that's good. I was born in the 1970s, okay? I went to Pittsburgh for dental school and graduated in 2003. After that, I did a residency at a hospital, Reading, Pennsylvania, which is right near where Taylor Swift is from, okay? Moved back to Texas in 2004. Our destination wedding was at Forklift. Then I had my daughter Isla in June 2010, sitting right over there. We opened our practice in 2011, so we've been around for, do the math, I can't do the math. Then I had my favorite daughter, Kira. No favorites here. Never my corporate job, and then started working at Willow Tree part-time. And then full-time since March 2023, my wife told me. Hey, give me the help. This is me and my wife at many of the weddings we've attended.
Where's one more cliff?
I was in Scrubs that day, so I had to work a normal day. That is my family. Obviously, Isla when she was a baby. My in-laws, brother-in-law, sister-in-law. And since we never had our traditional Indian wedding, we just crash other weddings and just see, take a picture. Here you go. So that's what we do. My mom, my girls when they were younger. I haven't updated the pictures yet. Jobs I've had is cashier, map tutor. The best job I've ever had is becoming a dad. And
the best.
You're gonna yell at me later for showing these pictures. Take your daughter to work day. That's the little one. Again, we like going out to eat once a week, but I'm really getting tired of Chipotle in and out. Gotta watch the cholesterol. Love swimming, don't go that often. Hiking we do, but it's too hot. Traveling, don't do that much. Reading, don't do that much. Huge sports fans. Love the Longhorns, Cowboys, Steelers, Rangers, you name it. Yeah, it's everything. This is our team. Sarah, my office manager. Wayne, our assistant. We actually have another assistant, the newest assistant. So we had our team meeting at the Ritz-Carlton. So just to see how their customer service is. If you haven't done it, you should.
Yeah.
The services we have are pretty much there, the same. Nothing's changed. We do the usual stuff: cleanings, exams, extractions, deep cleanings, and more things. Root canals, crowns. Same day crowns is something we do that if your dentist that you're going to is still taking those Play-Doh impressions on you, then they are behind the times, okay? A lot of things are changing, like any industry. I used to have a rotary phone, I don't anymore. So, STF treatment is something called silver diamond fluoride treatment. We have a cavity, it stops the cavity in its spot, so you don't have to drill. So it works on the little ones. So the last thing a little one wants to see my face coming at them with a drill. So a little paintbrush is not scary, because I'm not scary.
Zero to the Mexican dentist I went to whenever I was eating.
But now you don't go to East. Still traumatized. Since we do like differently, because my wife again told me, we take temperature on every patient. We do a weight check on children under 12. Why? Because we need to know their weight in case I need to juice them up. We take blood pressure checks at every appointment because everybody just went to the gym or just had 5 sticks of bacon and had 10 cups of coffee. We need to make sure your blood pressure is okay. We take full, if you've ever been to my office, that first initial visit is 1.5 hours long. And we take a full DSLR picture of your mouth, face, pull your cheeks back. We want to get in there, if you know what I mean. Our ideal referrals are really enough. Wow. The niche real estate agents. People are moving to the area and they buy from them and they trust them, so they want to find out who the dentist is, who to call for pest control. Obviously, it's word of mouth, which does help a lot. And thanks to you guys, which I don't have a slide, we were voted this year, finally, Living Magazine's best dentist. Word of mouth. So, thank you, whoever said that.
So he's out.
Next candy for you. Other healthcare professions and specialists. Okay, so our hours are pretty much there. And go to the website. You need to call, make an appointment, phone number, send an email. I mean, if you haven't been, what's stopping? All right. How much time do you have left?
3 minutes.
Okay. Well, this patient, that's why John and Salul can't answer right now, because they know the answer. I don't know if you remember from last year. Okay. So this patient got a baseball bat to the face or something, wildfire baseball or baseball, something, baseball related. So he got his front teeth kind of really hit, they got knocked out. So we had to splint that, and then he eventually lost one of those teeth. So this is a quick quiz. Which one of these two is the fake tooth? A or B? A, B. You said A first. A. All right, that's Darren right there. And Darren is correct because that is A. So it was a whole 2-year process, and he ended up losing the tooth and had to have an implant, and she put the crown on it, and so it looked like that, and now it looks like that. He has his front teeth, which is what he wanted for Christmas.
It take 2 years, so.
Wow.
All right, now this is the final product, and out of these A, B, C, D, 2 of them have been fixed, and so you want to guess? Take a quick guess. A, B, C, or D? B, C.
A.
B, C. Who said A first? Somebody?
I'll say
Jimmy. And then who said what?
C's.
Nope. E, C. Who said D?
Someone said, he said D is in there.
Yes.
Oh, no. Did you say D?
All right. So the
First round.
okay. So whoever said it, Lisa and Jimmy, got it. Okay. So this was the pre-op picture where this kid was born with what's called peg apples. Just that's how some people are born. There's not enough space. So the orthodontist made the space. It was a long year process, and that's the best they could make it look after braces. So it was a whole process of scanning and doing all this while he was in braces, removing the brackets, using computer technology to figure that out, plan the case, which is what all my wife did. I was just a pretty face standing there, the bell, holding people's hands. A little thing to, that's not a technical word, thing. I'm gonna move on, I'm running out of time. A little model to make the thing so that she could put that on and inject the filling material in there, and that's the before, the after and the before pictures. So it's not done in one day. You have to plan this in advance. So the whole point is if you want something fixed and you got a wedding to go to, don't show up a week before. You got to plan. You got to move teeth. We do it comprehensively, okay? Which means if you have a wedding to go to Carlos in a year, you better show up like yesterday, because we got to plan to move those teeth. We'll even grow your hair for
Said it.
do it. All right, so one last point. Brush the floss the ones you want to keep, because this just might happen, okay? So, here we are. Questions?
So you're British. Is a two-part implant versus root canals, and then what are overdentures?
Overdentures are, I'm going to do the overdent.
Okay.
It's like when you have lost all your teeth, then you have like, kind of like this, to pull the teeth out, and then you put like 4 to 6 implants in there.
Okay.
And then it kind of like locks in like your shoulder, like it. And then it ball and socket, and it just locks on it. And then you could remove it, keep clean. So that's what an overdenture is. Yeah.
As a patient, I've had a root canal and the implants, but I want to know what you think on. What's your preference, or you don't have?
If I'll always go is to try and save the tooth, because it's kind of like a tire. You get a nail in it, you patch it, but you do a root canal, try and fix it. Because if you pull it, that's fine. You can't go back, and then you have to go to implant or a bridge or something. So patch it, because the tire guy told me to. But if you got like 9 nails in the tire, you got to get a new tire. So you want to be as conservative as possible till we get to that.